hope everyone can hear me. I'll start off quickly. My name is Gail Clark. I'm the Director of Marketing and Community Relations at Littleton Regional Healthcare. I'm really excited about this presentation. And I know that I was talking to someone today and, they said the same. I think they said it's just overwhelming when you think about what you have to do. So this is a great topic. And I want to thank Robin from Harvard Pilgrim for being here tonight, because she is definitely an expert on this topic. I'd also love to thank Heather McKean. Heather is the marketing manager at Littleton Regional Healthcare. And she is going to facilitate the meeting. I don't know if that's the right word, Heather. But anyway, I want to tell you real quickly that Littleton Regional Hospital Auxiliary provided funds so that we could offer these virtual webinars. And we've had 4 so far, and they've been very well attended. Different topics. We're going to be continuing that next year. We feel that it's our responsibility as a hospital to offer health education and general education to the public. And this, of course, during COVID is the safest way for us to do this. So when we started, I had approached the auxiliary and asked them to sponsor this event, these events, and they did. They generously donated money so that we could offer these and promote them and get as many people to attend as possible. And if anyone is on the call that is from the Littleton area and would like more information about the auxiliary, I would encourage you to reach out to me. I'd be happy to tell you about the auxiliary. It's a great group of volunteers who raise money for the hospital. So, and they also raise money for scholarships for the community, high school students at all the local high schools. So they do a lot of great work. I am going to turn it over now, though, to Heather so that she can tell you a little bit about what she'll be doing, and then we'll turn it over to Robin.
Thank you, Gail. So at the bottom of everyone's screen, there should be a chat function as well as a Q&A function. I will monitor both of those. If you have questions throughout the presentation, feel free to type them in. Robin may take time throughout the presentation to address them, but for the most part, we'll probably get to most of them at the end. If you have any comments throughout, please just feel free to type them in, and I will keep an eye on those. Other than that, I will turn it over to Robin.
Well, thank you, Gail. Thank you, Heather. I appreciate it. I'm really excited to be here today. We're going to chat a little bit about Medicare. Why don't I go ahead and share the presentation? Right. So, Robin, my name is Robin Chouiniere. I've been with Harvard Pilgrim for 15 years, and I've been doing Medicare for 6 of those years. Prior to that, I did support the existing group team in large group, but I was also a Medicare advocate, helping families understand Medicare and what their benefits are for their parents or for their loved ones. So, at any rate, we're going to go ahead and chat a little bit about Medicare. What is it? Who's eligible, what's covered, what's not covered. We'll talk about the 22 deductibles, and then we'll chat a little bit about the options. What's a Medicare Advantage plan? People hear a lot about them, and it's like, no, they're all networks, and you can't do this, and you can't. And there's a lot of things that people, if you take the time to listen about them, there's a lot of advantages to Medicare Advantage plans. And we'll also talk about supplements. Our parents call them Medigap plans. We'll talk about prescription drugs, and then what plan is right for you. I'll give you some shopping tips on how to shop for different plans when you're talking to the different carriers. So Medicare is a federal program started in 1965. Between 150 and 240,000 people become Medicare qualified. What that means is they're turning 65 or disabled and under 65 for 2 consecutive years, the disability. But that number of 150 to 240,000 people seems like a lot to me. It doesn't mean they're actually taking Medicare at that time. Most people are waiting until their full retirement age, and full retirement age for a lot of us born in 1955, 56, 57, you're talking 66 and 2 to 66, 6 months, depending on your age. To be eligible for Medicare, you have to be 65 or older, disabled for 2 consecutive years, or permanent kidney failure or Lou Gehrig's disease. There are 4 parts to Medicare, A, B, C, and D, and we're going to go into a little bit more detail on each of them. But A is going to be your hospital, skilled nursing, so buildings. If you're trying to remember what's the difference between A and B, A is kind of buildings. Part B is all the medical services, doctor, lab, x-ray, outpatient, preventive. Part C is Medicare Advantage, it's a type of plan, and then Part D is prescription drug coverage. It is financed through your taxes. Part A, you've got, in order to have Part A free, you have to work at least 10 years and have your 40 credits. Okay. Part B has a monthly premium, and there is a chart that will talk about what the monthly premiums are. You can be enrolled automatically if you're collecting Social Security, or you'll have to apply. So if you are disabled for two consecutive years or collecting Social Security, it's automatic A and B. But if you're covered by an employer plan and you wish to stay on that employer plan, but you're already collecting Social Security, send your card back. So when you get your card with your A and B effective date, if you want to continue on the employer plan, send your card back. It's telling Medicare, I don't want my Part B right now. I want to stay on my employer plan. And there'll be no penalties because you are covered by an employer plan. And we're going to go into that. That's my number one question I get asked all the time. So if you are applying for Social Security, you have a 7-month window. I'm sorry, for Medicare, you have a 7-month window. So let's say you're either on the individual non-group, so healthcare.gov, or you're direct with a carrier, and you're turning 65. You have a 7-month window to apply for Part B. And it begins 3 months before your birthday and ends 3 months after your birthday. So if you are not covered by an employer plan, you're going to want to make sure you apply for your Part B benefits so that you're not subject to the penalty, the Part B penalty. If you're continuing to work and you're, let's say you're the employee or the subscriber decides they want to enroll in Medicare. At that point, your partner's spouse, who is pre-65, can take COBRA for up to 36 months. Usually a qualifying event due to Medicare, you're qualified for 36 months on COBRA. But understand that COBRA is not a qualifying plan under Medicare. So once you turn 65, you can no longer be on COBRA. You need to make sure you enroll in Part A and B and get onto a Medicare plan to avoid the Part B penalty. And if you're contributing to a health savings account, an HSA, you're going to want to make sure you're not enrolled in A or B, because you can no longer contribute to an HSA if you've got Part A or Part B. And if you are thinking about retiring and you say you're still actively at work contributing to an HSA, but when you retire, you also want to collect your Social Security, stop contributing to that HSA 6 months prior. So all these rules around HSAs. If those that have to pay for Part A have, those that have under 30 credits are going to pay $499 per month. And those that have 30 credits but short of 40 have to pay $274. So that magic number is 40 credits, which equals 10 years, because you can earn 4 credits per year Okay, and that's maximum amount, whether you're a high wage earner or not. So this is the number one question I get asked all the time. Can I postpone my Part B? And the answer to that is yes. As long as you're covered by an active employer plan, meaning you or your spouse or partner is currently active at work and you're on their plan or it's your plan, as long as it's an active plan, you can waive your Part B benefit and there's no penalty. Some people will say, well, do I have to enroll in A? Again, go back to the HSA. If you're contributing, then don't. If you're not contributing to an HSA, you can certainly enroll in Part A, get that out of the way. It gets you your card with your Medicare number. And that Medicare number is key. In order to enroll in any Medicare product, you have to have that number and enrolled in Part A and B. But once you're getting ready to retire, 3 months prior to your retirement is when you're going to want to start the process for applying for your Part A and B benefit, if you haven't already done A. And you're going to want that to begin the first of the month of your retirement. You do have a special election period, which is 8 months long. So let's say you want to retire January 1st. I suggest starting 3 months prior in October so that you can begin your benefits January 1st. But you do have 8-month window to apply for Part B without that penalty. Most people don't because they want their benefits to begin the first of the month of retirement. Okay. So just a quick review. The initial enrollment period is that 7-month window, 3 months before, 3 months after you want to apply for your benefits. Special election period is when you are working and you're deciding, I'm done, I'm going to get ready to retire. And one other thing I forgot to mention, if you do continue to work, maybe you're 67, I'm retiring now, there is an employer form that you will need to have filled out to go along with your Medicare application. And that's something I can certainly get to Gail and Heather so they have that available, or to HR. And then the general election period, you're 65 or older, let's say you're 67 now, and you decide, you know what, I don't ever go to the doctors. Why do I want to enroll in Part B and pay $170? That's when the penalty kicks in, is after that 8-month window or that 3-month window after your birthday. Then you don't get to enroll in Medicare Part A and B until January through March, and it doesn't become effective till July, and now you have all these penalties. So beware of your timeframes. Let's chat about what's covered. Start with Part A, your hospital. A is free, assuming you've worked for your 10 years. A is going to be your hospital, skilled nursing, hospice, mostly buildings. I mean, blood, obviously not, but mostly buildings if you're trying to remember the difference. Part B is going to be all the medical services: doctor, lab, x-ray, outpatient, preventive services. Under original Medicare, the preventive services are this compared to this on an employer plan. So on your employer plan, there's a lot more preventive services. Once you hit Medicare, a lot of those preventive services go away. Part B does have a monthly premium. For 2022, they just released it recently. It's $170.10. That's assuming 91,000 for an individual, or 100, and I have to keep checking my chart, 182,000 filing dually. And I believe there's a chart, we'll talk about that. But there are things that Medicare doesn't cover. Routine eye, routine hearing, dental, some immunizations, care outside the US, private nursing or custodial care. I'm going to use an example. My mom was in the hospital. Now they're getting ready to discharge her. And I'm looking, I'm thinking, she can't go home by herself. She can stand at the kitchen sink, but she can't prepare meals. She can't. What about bathing? And what about, and Medicare's like, not our problem. That's considered private nursing or custodial care. And they don't cover that. The big thing that's not on here is Medicare does not cover an annual physical after the first year, which makes no sense. Of all the preventive services, it should be an annual physical. But year number 1, welcome to Medicare. Here's your annual physical. Use it within 12 months. After that, it's a wellness visit. Difference between a wellness visit and annual physical, you're either in street clothes or you're in a Johnny. So when you're under Medicare and different plans, they don't cover physicals. So for 2022, the Part A hospital deductibles, the first 60 days, you're going to pay $1,556. That's just your hospital deductible, your room and board, if you will. Now, here's where I'm going to use mom again for an example, just to show you how just Medicare isn't enough. Mom was in the hospital for 14 months. The first 6 days, she'd have paid $1,556. She's still there, days 61 to 90. She's paying $389 a day. Days 91 to 150, those 60 days never replenish. Okay, you use any portion of them, that's it. So in mom's case, she used them and they were gone, $778 a day. And then days 150 and on, you're paying 100% of the cost. So you can see, and that's just your hospital portion, your room and board, if you will. Days 1 through 60, you have a knee replacement done. You go home, 63 days have passed, whole new deductible, okay, under original Medicare. The skilled facility, so you had the knee replacement, now you're going to a skilled facility. First 20 days is zero copay. Days 21 to 100, there's $194.50 per day. But Medicare makes you qualify for those days. So what that means is physical therapy, occupational and speech therapy are going to evaluate you. They're going to determine, okay, knee replacement, you're in there for a couple weeks. Once you get to a point where you've plateaued, you've gotten as good as you're going to get as an inpatient, they have to discharge you. It doesn't mean you're done with your therapy. It just means you're no longer inpatient. You'll now have either home therapy or you can go to an outpatient physical therapy. But then there's the Part B part of that hospital. Mom, again, in there for 14 months, that whole bill on the room and board. Well, now there's the Part B medical services. Part B does have a monthly premium of $170.10. And your Part B premium, and that's for 2022, is based on your 2020 modified adjusted gross income. They're always going to look 2 years back. So if you are a higher wage earner, they've just raised all these and I just got them about 2 weeks ago. 91,000 or less as an individual, 182,000 or less as a couple, you're at that 170/10 mark. Okay. You also have a $233 deductible and then 20% of the bill. So again, mom's bill, huge. Now you got the medical part of it with the deductible and 20% of the bill. So most people are like, you can't have original Medicare. So here's the Part B premiums, always based on 2 years prior. So if you're someone in this, say, down here in this category, you're paying $340.20 for your Part B. The following year, you drop down and now you're in this category, okay? So Part B will always adjust. It's going, the base amount is this 91 to 182,000 at 170/10. If you're a higher wage earner and you're in any other category but this first one, okay, from here down, you're also going to have a Part D income related monthly adjustment, Irma. And that adjustment goes from, what did they change it to? $12.40 up to $78. Okay. Added on, even though the drug plan could be included in your Medicare Advantage or you've got a standalone drug plan, that income related adjustment is simply because you make more than the base. So you want to make sure you think ahead. Your eligibility, you want to think about applying early, that 3 months prior to you're leaving your employer group, or maybe you choose to say, you know what, I think I want to just jump on Medicare now. By enrolling in Part B, that became your qualifying event to come off the employer plan and enroll into Medicare. You want to take a look at what your Medicare benefits are And you also want to look at the healthcare options available. So let's chat about what those options are. We start with a Medicare supplement or Medigap plan. Those are what our parents had. They've got some deductibles and coinsurance. There are limitations and things not covered. But these are national plans. I call them the ABC plans. Plan G is in George, currently the benefit richest program in the supplements. G is G, whether it's with carrier A, B, C, or D. In the state of New Hampshire, they're also issue age. And what that means is you are issued your policy at whatever age you are. So let's say you've decided at age 65, you want to go on a Medicare supplement or Medigap plan. You're issued your policy at age 65. That means you will always pay the 65-year-old age band. So when you're 85, you're paying the 65-year-old rate. That rate changes year after year, but you'll always pay that age band as long as you stay continuously enrolled. With Medicare supplement plans, you're carrying two cards with you. You're carrying your red, white, and blue Medicare card, and you're carrying your supplement card. Medicare is primary, so they're going to bill Medicare first, then Medicare is going to send it to your supplement carrier, and they're going to pay the balance based on whatever plan you have. There's no network, and they're fully portable. So off you go. Any doctor that accepts Medicare, you're all set. Off you go. They do not include prescription drug coverage, and they only cover what original Medicare covers. So remember, original Medicare doesn't cover that annual physical. Sorry, that's my house. One of the kids must be burning something. They don't cover an annual physical. They don't cover routine eye or routine hearing, dental. None of those things are covered. I apologize. So therefore not covered by a Medicare supplement plan. To be eligible, you have to live in the state of New Hampshire to enroll, but because they're fully portable, you can take that plan and off you go. You can move to Florida, California, wherever you'd like to be, but you have to be a legal resident in the state in which you're living to enroll. Okay. Under 65 and disabled for 2 consecutive years, you're eligible. You do have to be entitled to A and enrolled and paying the Part B premium. And you can only have one supplement plan or one Medicare plan at a time, meaning you can't have a supplement plan and a Medicare Advantage plan at the same time. You've got that 6-month period when you're first turning 65, that 3 months before and after. And it's always going to begin the first of the month. With supplement plans, they're pretty loose as far as the enrollment period when you can enroll. You can be on just original Medicare and at some point decide, you know what, I want to jump on a Medicare supplement plan. You can do that, but there are different times and it's different in different states. In New Hampshire, it's medically underwritten. So when you're first turning 65 or coming off an employer plan, you're no medical underwriting. Guaranteed issue. It's when you're several years down the road, you decide, you know, I think I'm going to jump on a supplement plan now. At that point, most carriers now have medical underwriting. So you'll have to answer some questions, and that could deny you coverage to a supplement, you know, these supplement or Medigap plans. But you can enroll on these pretty much any time. Whereas on Advantage, and we'll get to that, there are certain times of the year that are very strict that you can enroll. There are different plans. There are 10 different plans. A lot of these plans right down here have been retired. F as in Frank retired back in 2020. That was the benefit richest plan. But G is currently the richest one now. Basically, Medicare said back in 2020, you can no longer sell a supplement plan that doesn't have at least the Part B deductible. So Plan G, 100% hospital coverage, so you don't have to worry about a hospital bill. It has a Part B deductible of $233 one-time calendar year, and then everything's covered in full. Again, only those things are covered by Medicare will be covered by a supplement plan. Let's chat about Medicare Advantage. A carrier that offers an Advantage plan has a contract with the federal government and it renews on a yearly basis. With Medicare Advantage, they're either network-based, and in some cases you have a PPO where there's a non-network component to it. You're carrying one card with you. You're carrying your Medicare Advantage card. And that's it. When you go to the doctor, leave your red, white, and blue card at home. When you go to the doctor, you give them your Medicare Advantage card. They're going to the doctor bills the carrier directly. It's what I should have mentioned back on that supplement plan, those Medigap plans. Those rates can run anywhere from $100 up to $250 a month. And then you still have to get a drug plan ranging from 8, and I've seen them as high as 60. Whereas Medicare Advantage plans, rates can be as low as $0 a month up to say $150 a month. So you can, and they include prescription drug coverage, though there's a caveat to that. There are some carriers that offer a few plans without drug coverage. Someone in the VA would likely take advantage of that, or perhaps you have had a supplement plan for years, but never a drug plan. And now you want to switch to Advantage. You're going to want to look for one without drug coverage if you want to avoid the Part D prescription drug penalty. So Advantage plans, as I was mentioning, there are strict timeframes when you can enroll in them because it's a contract with the federal government. It's Part C. You've got the initial election period when you're turning 65. The special election period is when you are coming off an employer plan. Moving out of the area is another guaranteed issue period, or another period when you can enroll in an Advantage plan. And we're just coming out of what's called the annual enrollment period. It began October 15th and ends today. And anyone enrolled in Medicare can make a change to their plan, and that plan becomes effective January 1st. But if they forgot to make that change, someone on an Advantage plan forgot to make the change, Medicare has given you one more opportunity. I kind of call it a buyer's remorse. Maybe you went and you heard about the different plans, or you did went to different presentations like this and heard about carrier A, carrier B, and you're enrolled with this carrier, but you really liked what this one had to say. And you called and you talked to them and your docs and everybody's in the network. And you forgot to make the change by December 7th. Life gets in the way. You have one more opportunity from January 1st through March 31st. Anyone enrolled in a Medicare Advantage plan can make one more change and it becomes effective first of the following month. So if you make the change in February, it becomes effective March. There's a lot more covered under Medicare Advantage than covered under a supplement plan. You've got fixed copays for services. Most carriers are going to cover routine eye exam, annual physical. There are carriers that offer worldwide emergency care, also offer dental services. There's just more added benefits that they add to a Medicare Advantage plan. And the reason the premiums are significantly less is because carriers are getting reimbursed on average between $700 and $900 per member per month from Medicare to pay the claims, administer benefits, have these extras on there. And it's an average. Someone that goes to the doctors a handful of times a year might get reimbursed. That $700 is going to be much less. Someone with cancer or higher heart attack or higher claims, if you will, utilization, that $900 might be more like $1,000 to $1,100. Okay, so that's how carriers can offer these plans for less money. But there's far more covered under a Medicare Advantage plan. There are different types. There's an HMO or an HMO point of service, and everybody's familiar with how HMOs work. You've got a network of doctors. You're staying within that network. A point of service also gives you the ability to see providers that are out of network for non-emergency services. So an emergency service can be anything as to a earache or sore throat that you're going to the corner down to the urgent care, all the way up to I'm in Europe if your plan covers worldwide or within the country, and I've now been admitted into the hospital. You've got that care, whether it's an HMO or point of service giving you that extra level of, you can see an out-of-network provider for non-emergency services. Different carriers have different rules around their HMO, whether it's a referral where you have to see your primary care in order to get a referral to see a specialist. Most carriers don't have that referral process in place any longer, though. You'll want to check with the carrier as you talk to them. The PPO is going to be similar to the HMO, whereas you've got the HMO in network. Go to in network, it's going to pay these copays, but it also allows you to go out of network. So similar to the point of service, you could go out of network, but the out of network component on a PPO is going to have higher cost share than it would on a point of service. So in a PPO, you may be paying co-insurance, meaning your co-insurance 20%, 80% for the carrier, but higher deductibles, higher co-insurance, but it allows you to see or have procedures done out of network. Again, prescription drugs mostly included on these plans. When you are looking around, check though, because if there's this whole commercial that they'll pay you your Part B premium back if you join our plan, beware of that plan, those plans, because they mostly don't include prescription drug coverage. And the last thing you want is to get all enrolled in that plan and find out that it didn't have drug coverage. Things to consider on the supplement plans or those Medigap plans, Plan G, for instance, is that there is no network. It works with original Medicare. It's fully portable. So if you're living here in New Hampshire, Mass, Maine, wherever it is you're living, you can take that plan and off you go to your new state. You want to check the prescription drug coverage to make sure that your prescription drug coverage is portable as well. Medicare Advantage plans, more comprehensive coverage, more things are covered. Routine eye, routine hearing, dental, hearing aids, perhaps. Different carriers are going to do different things. Annual physical. It's one card. Your prescription, it's going to have your prescription drug coverage and your medical all wrapped up together. And significantly lower premiums. So the drug plan. Back in 2006, it became mandatory that you had to have a drug plan. If once you turn 65 and older, that's either creditable if you're on an employer plan. And I do believe that if anyone's here from Littleton Regional, your employer plan is creditable, which means the prescription drug portion of that plan meets or exceeds Medicare's base plan. So if you are employed, and you're hitting 65, make sure that you either have the letter from the employer saying your plan meets Medicare creditable coverage, or you check with your employer to make sure that it does. Because if you're 65 and over and covered by an employer plan and that plan does not meet Medicare creditable coverage, you will be subject to the prescription drug penalty. That penalty is 1% of the national drug. So the national drug cost average is $34. So it's going to be 34 cents times the number of months that you've gone without creditable drug coverage. And if you go past 63 days as well, you're subject to that penalty. That penalty stays with you forever. And it seems small money now, but what could be bigger is that you're plugging along without a drug coverage. You're on a supplement plan, and I don't need drug coverage. It's just not. I'll pay the penalty if that comes up. But now all of a sudden, something happens and you're prescribed an inhaler. Those can be up to $350 up in there. Or some expensive drugs. Some of the meds I've been chatting with can get pretty expensive, and that's where you don't want to get caught. Part D plans are offered through private insurance plans. A lot of carriers chose not to offer their own Part D plan to go with a supplement plan, if you will, because in the state of New Hampshire, there's nearly 29, I think it is, different plans to choose from. And it's all based on your zip code and the meds you're taking. So what might be the right plan for you at $8 a month, your spouse or partner's plan might be $30 a month because they're taking different meds. So a lot of carriers chose to not sell their own standalone drug plan. But if you are working with someone, they should be helping you. If you're enrolling on a Medicare supplement plan, they should be helping. They should be going out to Medicare.gov and looking up a plan for you, because what's really great is that you just go out to Medicare.gov, you put in your zip, you put in your meds, you filter it by the lowest drug plan, the lowest drug cost and lowest premium. Okay. They all vary very, differently, the standalone plans. There are subsidies for low-income beneficiaries, and there are state pharmaceutical programs available. So if you have some concerns about that, please ask, and I can help you out with that, finding some help. So, did I not update this screen? Let me check. I did. Okay. So this Medicare created the program, this Part D, and maybe that's why it's confusing, because it's a .gov. Medicare said you can't have a deductible more than $445 on your plan. The initial coverage period is going to be $4,430. I'm going to explain how it works. And also in the gap, $7,050 and 25%. So Medicare created this. The way it works is, let's say you're going off to the pharmacy to pick up the first med, and the true cost of the drug is $30. You've got a copay. So I like to start it with an empty bucket, and we're going to fill it up until it hits $44.30. It's the true cost of the drug going in there. So if you're on a bunch of generic drugs, you're never coming close to that $44.30. But let's say you put your amount in, your copay, or what you're responsible for, the carrier is going to put the balance of that amount in. If you're taking brand name drugs, your deductible will go into that. The deductible can be a small amount, but it can't be greater than $445. So your deductible's going into that bucket. Your portion, your copay is going in there, and the carrier's going to pay the balance. If you're on brand name drugs, you will use that $4,430 up. If it's something like inhalers, those are typically fall in a tier 3, if you will. You might be in the gap somewhere around the 7th or 8th month. Okay. But you're plugging along, and all of a sudden you've now filled up that bucket with $4,430. You're now going to go into the gap. Our parents used to call it the donut hole. Back in the day, the donut hole, you paid, our folks paid 100% of the cost of the meds. Now you've got a new empty bucket, $7,050. Take out of this first bucket whatever you put in there. So your deductible and any copay amount that you paid towards that $44.30 is going to come out, and we're going to dump it in this new bucket of $7,050. Your generic, all your meds are going to be 25% of the cost at this point. So you've got a $1,000 drug, you're going to pay 25%. 25 goes in the bucket. Any of your brand name drug, the manufacturer is going to pay 75% of that. So that $1,000 drug, you're paying $250. The manufacturer is going to pay $750. All right. Brand name drugs, the manufacturer does not kick in any amount because those drugs are cheap. So you're paying in this period 25% of your cost. Manufacturer is going to kick in 75% for all those brand name drugs. If you are on any expensive drugs, tiers 4 and 5, you will use up that $7,050. you're going to cross over into the last level of coverage, which is called catastrophic. And at that point, generic drugs are the greater of 5% or $3.95. All other drugs are the greater of 5% or $9.85. And then January, you start all over again. And if I were in the room right now, I'd say clear as mud. So again, what goes into this first bucket, this initial coverage period, is the true cost of the drug and your deductible if it applies. So that true cost is your portion, the insurance carrier's portion, deductible if it applies. Whoops. Now you've hit that bucket, take your portion only out of it, put it in towards that $7,050, reducing that amount. Now you're paying 25% of all drugs. Manufacturer is going to kick in 75% the brand name till you hit $7,050. In my experience, most people are not hitting that $7,050. I've had a small handful over the years, but then if they do, they're down here in the greater of 5% category or the copay. You're going to want to make sure that you check with HR to see if there is a group retiree benefit available, whether it's with Littleton, perhaps your spouse or partner is on a plan that offers a retiree benefit. Check to make sure that there isn't a benefit available to you first. You want to make sure that you learn what the enrollment process is, because there are some employer groups that say, yes, we give you X amount of dollars per year to go shop, but you have to go through our exchange or our broker to be able to get the money for that. So you want to make sure. You want to compare the benefits and compare the monthly premiums, because a lot of times group retiree benefits aren't subject to that same 3 tiers of the drug plan because it's a group retiree plan. It acts very similar to an employer plan where medical and prescription drug all go towards the out-of-pocket. So you want to check with that. Make sure you're asking those questions. So what plan is right for you? You want some different shopping tips. The supplement plans are supplement plans. There is not any difference with G, with carrier A, B, C, or D. G is G. What does the carrier offer? Are there any discount programs that the carrier offers? Where is their member services located? Okay, that could be important to people. Medicare Advantage, on the other hand, very different in the state of New Hampshire. Every carrier is very different. Some carriers have offer different plan, worldwide coverage. Some don't. The rates, the prescription drugs, where your drug falls in their tier. You want to ask the question, when I go into the hospital, am I discharged when the plan says I've stabilized or when the doctor says I'm ready to be discharged? There's a huge difference there. All plans, most of the plans in New Hampshire have all the hospitals, but there's only one carrier that that has all the providers at all the different hospitals. So you want to ask that question. You may not need that different provider today, but you want to know next week or a month from now or something, I need this provider all of a sudden. Well, you don't want to find out they're an out-of-network provider or that you're not able to see them. So ask about the network. You want to make sure you shop carefully. Also beware of lapses in coverage. 63 days without drug coverage, now you've got that Part D penalty. Also on the Part B, make sure if you're turning 65, not an employer plan, you're making sure you enroll within that 7-month window, or coming off an employer plan, you've got an 8-month window. I'm always telling folks, please start 3 months before so you get your card in time to enroll so that you're starting your plan, first of the month of retirement. There's some different resources. ServiceLink is a state agency in New Hampshire. They can certainly help you with some different things. There are broker agencies that can help. There's some different resources along the way. I'm going to stop sharing. No, I'm wrong button. There we go. Are there any questions, Heather or Gail?
We did have one come in. Let's see. My husband turned 65 last year and he's still employed full-time. We are covered under employer's insurance. He did sign into Part A for Medicare. We contribute to an HSA. I think I heard you say that is not allowed. Did I hear correctly?
That's correct. If you have an HSA, you cannot have Part A or B and contribute. Though if you're contributing at a family rate and say the spouse is the one that enrolled in Part A, the employee, the subscriber can continue to contribute towards an HSA, but at an individual rate, at the individual amount. If they've already gone over that individual amount, then there's going to be some penalties. So check with the HSA vendor to see what their rules are around that. Did you have something you want to share with that, Gail?
I saw Judy's question, and my husband is, retired. Not really. He still works, but he's on Medicare. He has an HSA. And then when I enrolled for my healthcare coverage through LRH, I was told what you said.
Mhm.
And so they suggested that I only do my HSA for 6 months because I'm, going to apply for Medicare
Okay.
in November. And Alan said to me, that's not true. And I said, it is
No.
true.
So you can actually be enrolled. The 6-month period only applies if you're going to collect Social Security as well.
And
But-
I don't know that yet.
Gotcha. So in
So
that case,
that-
you'd probably want to stop. But I have an HSA. And the reason I have an HSA is so that when I retire, HSA comes with you. That's
Right.
your money. It's not a use it or lose it. I plan on having that there to pay for my premiums for my Medicare. If I, I'll probably personally go on a Medicare Advantage plan. If I go into the hospital, I'll have a little kitty of money for that hospital copay. It can pay for a lot of things, my HSA. So that's why I'm that's why I'm using an HSA. So your husband can have an HSA and use it after retirement. You just can't contribute to it if you have A or B.
Okay.
Yeah.
Okay. I'm sorry. And I've got to check now because I don't think I signed up for it because of what you're
Yeah.
saying. And now
Yeah.
I wish I had.
Yeah.
It's very, very, very good presentation.
Thank you.
But they're very good. But there are so many what ifs.
Oh, yeah.
Do you provide like personal counseling?
I do. If anybody wants to reach out, they can either contact you directly to get my information, or I'm happy to share my phone number or email.
And would you share the presentation? So
I
that
do
we
this
can-
in the community. I do the full version actually has Social Security in there as well. And it's
Okay.
about an hour and a half easily, the full version, but we'll also have it on our website.
Okay.
HPH, Harvard Pilgrim .org/celebrating 65, and you can actually watch. I haven't recorded the 2022 version yet because we just ended AEP today, the annual enrollment period, but I do these in the community throughout the year. I do them for employer groups throughout the year, but I'm also available to chat.
Where do you do those in the community?
Right now, everything's virtual. Everything's
Okay.
virtual. Back in the day, I've done them at Littleton. Yep,
I would really, we may want to consider doing that.
Absolutely. Yeah, absolutely. Come the probably spring, summer time frame,
Yeah.
as we hopefully come out of this
Well,
nightmare. Gosh.
We have a request if you could just repeat the web address one more time.
Sure. So it's harvardpilgrim.org/celebrating 65. Or if you'd like, Gail, do you want me to share my number? Or do you want to
Would you
have people call you.
Would you share the PowerPoint presentation?
I
with me?
can share.
And
I
then
think,
we can
yeah.
we can
and then,
share it with participants, because it's it's good to have something.
Yeah.
that you
Yeah.
can
The
read.
/celebrating 65, you can actually go out and see
Yeah.
the mod. It's broken into the 3 pieces. So you don't
Yeah.
have to watch the whole thing in one. You
Yeah.
can go out and watch a little and here and there and can
Yeah.
kind of take
And then if you would
screenshots.
share your contact information, we'll get that off to everyone.
Sure. I'll put all that
Yeah.
in one email then for you. Absolutely.
I don't think I'm ever going to retire.
It's confusing, and I
it's
do this
like-
every day. It's so much
Yeah.
fun. I get to chat with people, and I've spent hours on the phone. It's whatever you need, but I get to help them understand what Medicare is, and
Right.
and even if it's just an education, and now they're armed, they understand, and we'll catch up with you later
Yeah,
when it's
right.
time.
And it really did, it helped knowing about the the Medicare Advantage, the Medigap. I mean,
Yes.
yeah.
Yeah.
And
Well,
making
Medicare
sure
Advantage has a little bit of a bad rap because it's all network and you have to stay in the network. Well, there's carriers that have a pretty broad network.
Right.
Yeah. And a lot of benefits to
Right.
it. So.
Yeah. Yeah.
Yeah. Well, I thank everyone for coming today.
Yeah. Do we have any more questions, Heather?
No more questions. I'll put this out there kind of as a last call for questions. If you have any, please feel free to.
There we go. I think we have one.
Oh, there we go. Just
Yay.
thank you. And yes, thank you, Robin. This was very
You're welcome.
informative. What we will do, similar to the past virtual health and wellness events we posted, this recorded session will be available on the LRH YouTube page, Facebook page.
Awesome.
Yeah. Thank you very much, Heather.
You're welcome. Thank you, guys. Thank you.
Robin.
I
Yeah.
enjoyed this.